I want you to meet my friend Darius. Darius has complete kidney failure, and his chances of being alive today are just 30%. Thankfully, he's still with us, living an extremely fulfilling and influential life. He's a great guy. But this past month, his access site, or artery vein connection created in his arm for dialysis, collapsed and failed. He now has just 3 more chances before he's completely relying on a centralized catheter, highly prone to infection and failure, to survive. Hi, I'm Tim Boyer, and I'm here today because it is my dream to impact the lives of patients like Darius using a device that I developed over the last 5 years of my PhD at Vanderbilt University in Nashville, Tennessee. Darius, unfortunately, is not alone, as chronic kidney disease afflicts 1 in 10 people in the world. In the US, it's the number 9 killer, and there are enough people afflicted to fill my states of Texas and Tennessee combined. Complete kidney failure affects over 2 million globally, and the 680,000 patients in the US is enough to fill my entire home city of Boston. These patients are primarily relying on dialysis to survive. To initiate dialysis, an artery vein connection is created in your arm. Unfortunately, our current standard of care, which is to provide no additional support to this access site at the time of surgery, results in half of these access sites failing within the first year. This is unacceptable to us. This is why we're doing something about it and creating self-wrap, a patent-pending shape memory polymer wrap to prevent access failures. For dialysis, an artery vein connection is created in your arm. This can be a direct connection of artery to vein called a fistula, or a graft can be used for this connection, as shown here. When a graft is used, the graft's first connected to the artery and then to the vein. Our product would simply slide up this graft before securing that connection of the graft to the vein. Then, upon securing that connection of graft to vein, our product would slide down over this interface, and as a moldable shape memory polymer material at body temperature, would self-close over this interface to provide non-constraining mechanical support and promote outward vein growth to the area most prone to failure, the vein graft or vein artery junction. Differentiating ourselves from our competitors, our product can provide durable, flexible mechanical support, be custom fit to the patient's specific geometry to promote more uniform outward vein remodeling, and do so in a self-closing and sutureless manner to make it quick and easy to implement at the time of surgery. So the impact that this can have on patients is the potential is self-evident, as reducing redo surgeries and infections from catheter reliance can improve their quality and length of life. For providers and payers, there's significant potential benefits as well. For surgeons, it's an easy-to-use medical device to improve patient outcomes. For hospitals, it could reduce readmission penalties and lower facility costs. And for dialysis clinics, it can recoup revenue loss when patients are rehospitalized due to access failure, as well as extend the lives of their client pool. This can also provide significant potential cost savings for payers, such as the Centers for Medicare and Medicaid Services, by avoiding the need for redo surgeries, especially beyond that 90-day readmission penalty window. This value translates to a $450 million US market for all dialysis access surgeries. And as this can be proved useful anytime an artery vein connection is created, such as in peripheral and heart bypass surgery, this represents an approximate $1.4 billion market opportunity in the US. Market entry is contingent upon the FDA clearance timeline of our Class II device, which we anticipate to occur in 2021. This may sound like a long time, but we don't necessarily need to get all the way to market to have an exit. Vascular surgery technologies are acquired across the spectrum. For example, Pervasive Therapeutics was acquired by Shire for $200 million prior to FDA approval. An even earlier exit is also possible, such as when Guidant acquired a bioresorbable drug-eluting stent technology for $16 million soon after completing a 28-day animal study. To date, we've raised over $300,000 in federal grant money to optimize device design and engage contract manufacturers. We've interviewed more than 100 healthcare professionals to validate a product market fit. We've filed 2 patent applications, and believe we have a clinical champion to initiate clinical trials and accelerate market penetration. Our leadership consists of myself and Jeffrey Lux. We're supported by a team of surgeons, engineers, and entrepreneurs with extensive expertise in product development, business strategy, and successful healthcare exits. Today, we're seeking additional funding to manufacture our final product, complete FDA-compliant preclinical studies, and cover patent costs to reach patients like Darius around the world. If you want to join us in our quest to impact the lives of the hundreds of thousands of patients like Darius, please talk to us. Together, we can show the world a better way. Thank you.